Hello guys, welcome to Ankit Sunyal Vids. Today I'll tell you how to write a death certificate. And after this video, I am definitely sure whenever you guys will write a death certificate, then everyone will appreciate it for its precision and its good details in it. So let's start it. So basically, what is the most important thing in a death certificate? The most important thing in a death certificate is the cause of death, obviously. Then how do we define it? What is the cause of death? It is defined as a disease or an accident, or it could be an injury which started the chain of event. So what is this chain of event? Means if person got some accident or some disease, so that is the first event, and then that will subsequently will lead to the another disease or another event, then that will lead to the third one, and so on, and in the end which will cause a death of an individual. Death is the terminal thing. So here, what is the cause of death? The cause of death is the first event. It could be neonatal tetanus, low birth weight. Remember, later we will see low birth weight could be a risk factor also, or it could be a cause of death also. It could be a snake bite, asthma, coronary artery disease, stroke, asphyxia at birth, fall from height. There could be a road traffic accident. In case of road traffic accident, we have to mention both the parties. So basically, this is the form how it looks, and most of the countries have some little bit variations, but the parts of the form generally remains the same everywhere. So what all does it contain? It contains the name, gender, age, and it will contain the name of the hospital, from which ward, on what is the date and time. These things you should not miss. This is the basic detail which need to be filled very properly. The parts of the form are part 1, are part 2. Here it is written as part 1. You can see the part 1 contains immediate causes, it contains intermediate causes, and it contains a cause of death. Just remember, in the part 1, cause of death is always at the bottom and the immediate cause is at top. I want to tell you one more thing, that the mode of death is not mentioned. What is the mode of death? Mode of death is like something cardiac arrest, respiratory arrest. Then the second part consists of risk factors or the contributory causes. Generally these are diabetes, hypertension, smoker or alcoholic times. Here is the interval duration before the death, 5 minutes before, 10 minutes before, or you can write approx also. You can write it in days, you can write it in hours, you can write it in months, okay, you can write it even years. You can also write it as unknown, you can write it as since birth also. This timing part is very important. In the timing section, what you should not write is a while, long time. These things you should not write, because a death certificate need to be very precise and very crisp. And in some of the death certificate will contain manner of the death. If you can find out, it is very good, like whether it was a natural death or accidental or suicide or homicidal, or it could be a pending investigation. So basically there are 4 steps. You have to read the history very carefully. History is very important. That will help you a lot, as generally we tend to give importance to positive symptoms. What I would like to say is you have to look at the negative symptoms also, because that will help you to rule out other diseases. You look at the history of immunization. If some person is immune or some person would have taken vaccine, so it's rarely that the person will die of that disease. You have to look at the history of hospitalizations. These are the some key focuses which you should also look at the history. Then after looking the history, then you have to organize the event. What thing happened first, what happened second, and what happened next, and further on till the death. And with the chronological order, you should write the time of each thing you should write. Then you have to use your best clinical judgment to find a single cause of death. You cannot write a multiple cause of death, fracture, fall from height, pneumonia, everything you cannot write on it. Very rarely there could be 2 underlying or more than 2 underlying cause of death. That's very rare. Mostly it's always a single cause of death, and you have to use your clinical judgment, whether is this associated with this, will it cause the second event or will it cause the third event. So all those correlation you have to look at. The fourth thing is, from ICD, International Classification of Disease, you can use the particular phrases or words and you can use its coding. I know it's very difficult to remember ICD-10, but when you start practicing, then some codes will be very familiar to you, because like there are some most common diseases, similarly there are most common ICD codes which are used. As I told, you have to look at history, the disease, the accident, signs and symptoms. For example, if there is in history it is mentioned that 39 weeks of gestation of a pregnant woman, she delivered a baby. So what does this 39 tells you? This tells you this is a full term pregnancy, and full term pregnancy will rule out the prematurity. You have to arrange them chronologically. Timings are very important. Which is the first event? Is there any causal relationship with the immediate cause of death or not? So then you have to identify a single disease or accident. You have to use the ICD coding just to maintain the consistency. This is why ICD is used, to avoid the confusion. Like snake bite, which result into bleeding disorder, then that result into renal failure. Here the cause of death is the snake bite, not the renal failure. Here the cause of death is asphyxia at birth, not the prolonged labor. Then if you look at another examples, fall on the same level from slipping, that result into hip fracture, and because of hip fracture patient was immobile, that resulted into pneumonia, and that caused the death. Here pneumonia is not the cause of death. Hip fracture also is not the cause of death. The cause of death is the fall. So let's look at the second part of the death certificate, which keeps risk factors and contributory causes. So risk factors are the factors which indicate the high risk of a disease. They don't start. Just remember, they don't start the events. Like here, if you look, hypertension causing stroke, then stroke causing immobility in the person, that causing bronchopneumonia and death. Here the cause of death is the stroke, and the hypertension is a risk factor, because every hypertensive patient do not develop stroke. Here like low birth weight, that is causing a failure to thrive for definitely, and then subsequently causing a death. So here low birth weight is a cause of death. But here low birth weight causing a diarrhea, because making the immune little poor, and then causing dehydration and death. Here the diarrhea is the cause of death, and low birth weight is just a risk factor. If the patient is diabetic and is on insulin, and if he takes excess insulin, he goes into coma, then causing lactic acidosis, then finally going into cardiogenic shock. So here the cause of death is diabetes on insulin. Diabetes do not remain a risk factor now, because it's causing the first event. So here I will give you some certain tips. The tip is you have to be very specific and precise. Like you can't write patient died because of old age. It's very vague. Like you can't write anemia as cause. You have to write the subtype of anemia, which anemia caused it, and you have to write one disease in one line. You can't write lot of details in it. And never use abbreviations. Abbreviations are never used. Like you can't write HTN for hypertension, DM for diabetes, and don't forget to write the time intervals. Those are very important. And the immediate cause is written on the top, and in between there could be 2 intermediate or 3 intermediate cause, or there could be only one. So intermediate causes would be multiple. Immediate and cause of death is generally only the one cause. If there is no intermediate cause, then you don't have to write it like this, like immediate on the A and cause of death in the C, and you leave the B as blank. Never leave a blank in between them. If there is a condition where is only immediate and the cause of death, what you do is you write the immediate here and write the cause of death here. Cause of death always at bottom, immediate cause always at top, if there is no intermediate. Intermediate causes are generally the causes which could be prevented by physician from progressing. If coming to the risk factors, never record a risk factor as a cause of death, which is a common mistake. Risk factors are not the cause of death. Cause of death is always at the bottom of the chain of event. This is your chain of event, and risk factors are never the part of your chain of event. Don't write with pencil. Don't use whitener. If the cause of death is unknown, then you have to mention unknown. It can be unknown. This sequence should be in this direction, from bottom to top. Generally, the people write from top to bottom, which is not good. So these are the tips which I just discussed with you guys. If you guys are more interested, then you can do a course on death certificate by Center for Global Health Research and with ICMR. These two people have collaborated to give you this ADDC course, and in the end of this course you will even get a certificate issued by ICMR and Central for Global Health Research. The link I have written here also, and I will give it in description box also. Please go through it. If anyone interested in buying Kindle ebooks or the questions bank, which also contain now answers also, if you are interested in that, then you can go to the Kindle ebooks on Amazon. So thank you guys for watching this video. See you guys in the next video. Tata, bye bye.